So we've teamed up with Wimber to develop the cervical collar because there was a need to find a better solution to stabilize the neck of patients with atlantoaxial instability or vertebral fracture or vertebral instability in the neck. Currently, what we're using once the diagnosis has been made is very often a large cast. First, it's heavy. Second, it creates complication with skin problems, ear problems, ocular problems, and you have to change that bandage pretty much every week, sedating or doing short anesthesia to replace that cast in order to prevent all those problems. So the solution that Wimber came up with was to develop a collar that will be lighter, aerated, with very little contact points onto the skin, yet allowing stabilization of the neck with support underneath the chin, underneath the neck, and underneath the sternum. The application of the collar is actually quite simple. You slide the collar over the head of the dog and you fit in his little paws. Then at the back of the collar you have a wheel which is tied to little ropes that will basically gently put pressure and get the upper and lower parts closer to each other, bringing the required support. This is very nice because it's aerated, so there is not the massive contact surface of a cast, if you want, and it has support underneath the neck so that the dog cannot lower the neck and bend this atlantoaxial joint, which is what we're trying to prevent. It also brings a little bit of support over the sternum, similar to the cast, then putting a little bit of cancellation of the movement of the upper and lower articulations of the neck. So what I really like with this system is that 3 sizes are available. They are all pre-printed, off the shelf, available for shipping, which makes the time between diagnostics to applying the collar as short as possible. So I would really highly recommend that you try it. What I do is I have a set of 3 colors. I have the 3 different sizes in the practice, so that when I have a case, I can apply one of the 3 colors and have the one that best fit the patient in which the atlantoaxial instability has been diagnosed. So whether you are trying conservative therapy or whether you are buying a little bit of time to do those 3D printed drill guides to optimize and do a safer neurosurgery, then the Wimber cervical collar is certainly a very good option for you.